Hi, this is Edusam. Welcome to my lecture on the gross anatomy of the lower limb. So in this video, I'll be introducing you to the lower limb. So what is lower limb? The lower limb is otherwise called the lower extremity. And this is the part of the body that bears the entire body weight, the part that is used to walk. So it's basically used for locomotion. So this lower limb is connected to the trunk, to the axial skeleton by the pelvis. This lower limb that you use to walk is connected to the axial skeleton by the what? By the pelvis. The pelvis itself is also part of the trunk. The trunk of the body is just made up of the thorax, the abdomen, and the pelvis. The pelvis is the lower trunk. So what's connected to this pelvis is the lower limb. So the lower limb is attached to the pelvis. The pelvis is connected to the axial skeleton. Yeah. So the lower limb generally has about 4 regions. You can see that on the slide already. We have the gluteal region, which is the buttocks region. We have the thigh region. We have the leg region, and we have the foot region or pes, the foot region. So these are the 4 regions that are to be considered in as much as this lower limb is concerned. Alright, so each of these region has its own bone. For example, the gluteal region, the bone you can find at this region is basically your pelvic bone. It's your hip bone. And a lot of muscles also and ligaments in each of these regions. The thigh region is known to have a unique bone called the femur. The femur bone. The leg region has 2 bones. That is the tibia, which is medial, and by now I believe you know what medial is. And we have the fibula, which is lateral. Then lastly we have the foot region. Alright, so in the next slide, telling us about the fact that we have about 33 bones in the entire lower limb. 33 bones with the hip bones inclusive. So if you exclude the hip bone, what you are going to have is 30 bones. So if you exclude the hip bones, you have 30 bones, but if you include the hip bones, you have what? You have 33 bones. And these bones have been listed here to be the hip bones, which is made up of 3. We have the femur bone, the patellar bone, the tibia and the fibula, the tarsal and the metatarsal bones, and we have the phalanges. If you sum up these bones, it will give you a total number of 33. The hip bone is composed of 3 innominate bones, namely ilium, ischium, and pubis. So in most cases, we tend to say that the hip bone or the pelvic bone contains 3 bones. So 3 bones comes together to form this hip bone. Whereas in some school of thought, the hip bone is being counted as just a single bone, and that will make the total number of this to be 31. Alright, so now let's dive into each of these regions. The first part we're talking about is the hip bone or the pelvic girdle. That's called the pelvic girdle. The hip bone is made up of 3 innominate bones, namely ilium, ischium, and pubis. And what is the function of this hip bone? It allows attachment of muscles and ligaments. It connects the lower limb to the axial skeleton. And this hip bone is also important, it's also significant in the area of identifying the gender. So hip bone can tell you if a particular person is a male or a female. In the lab whereby you are giving a specimen, you can be asked that this particular bone or this particular hip bone is for what gender. So if you know the difference between the female and the male hip bone, you should be able to identify. So that is why it is being written here that it has a clinical function, not a clinic function, of gender identification, and is also linked to childbearing. If a lady is having an android pelvis instead of having a gynecoid pelvis, such a lady won't be able to give birth because ladies having a male pelvis, childbearing, which is not which does not permit childbirth. Alright, so now let's talk about each of these bones. So we'll start with the ilium. So the ilium bone, otherwise called flank, is the largest of the three bones. And let me give let's check an image of the ilium bone. Just a moment, please. Good. So the ilium bone is the largest of the three, and as you can see, it has something called ala, or you say wing, and this wing has what we call the iliac crest. Superiorly, you can find what we call the iliac crest, which is for the attachment of some muscles, which are the abdominal muscles, the muscles of the abdomen. They sit on this iliac crest, and some ligament as well. Now, if you look at the anterior surface of the wing of this iliac fossa, which you can find anteriorly, you have what we call the iliac fossa. So, and that iliac fossa is just basically for the attachment of iliacus muscle. The iliacus muscle take origin from this iliac fossa. So another thing is, if you look at the posterior aspect of it, or let's look at the the posterior aspect. Yes, you can see the posterior aspect here. You can see spines. So on the ilium we have what we call spines. Just these projections you can see here. Those are spines. So you can see the posterior superior iliac spine, posterior inferior iliac spines, anterior superior iliac spine, anterior inferior iliac spine. So basically we have four major spines in the ilium. This is the axis, AIIS, PSIS, PIIS. So, and while knowing these spines, you also need to know certain things that are common to these spines. So we'll pick each of these spines one after the other. Let's start with the axis. So the spines, the axis, that is the anterior superior iliac spine. It's very, very important. And it is common to note that this axis is the origin for the inguinal ligament. It serves as the origin of the inguinal ligament. And aside from the inguinal ligament, we also have a number of muscles that originate from there, such as number one, the sartorius muscle, which is the longest muscle, otherwise called the tailor muscle. Let me show you the image of the sartorius muscle. This sartorius muscle, you can see it coming from the axis. This is the axis here. So you can see the sartorius muscle coming from the axis. You can see, let me show you the inguinal. I have an image showing us the inguinal ligaments. So you can see the inguinal ligaments coming from here, and starting somewhere around the pubic tubercle. Yeah. Alright, so that is about the axis. So secondly, we also have the AIIS. That is the anterior inferior iliac spine. The anterior inferior iliac spine. So the anterior inferior iliac spine serves as attachment for the the rectus femoris muscle, rather. So the rectus femoris muscle originates from this AIIS. For your information, you need to know that rectus femoris is part of the muscles that form the thigh, the anterior thigh. So anterior thigh, we have a set of muscles there. They are four in numbers. We call them the quadriceps muscle, and one of the quadriceps muscles is this rectus femoris. Rectus femoris. All right. So At the posterior part of the ilium, we have two other spines. That is the posterior superior iliac spine, and we have the posterior inferior iliac spine. These two spines I mentioned lastly are basically for the attachment of the sacroiliac ligaments. I'm going to show you image of that. So if you look at this posterior view, you can see the sacrospinous ligaments cutting across the posterior superior iliac spine. Good. So now let's talk about the ischium quickly. The ischium. The ischium is the second part of the pubic bone, and the ischium can be more noticeable posteriorly. You can see it here. This is the ischium here. So posteriorly, you can appreciate the ischium. Superiorly you have the ilium. Posteriorly, you can see more of the ischium, and over here you can see the pubis more anterior. The pubis more anteriorly. So there are some few things you need to know about the ischium. Just give you some few points, and basically I will just talk about the structures that you can find on the ischium and things that are connected to those structures. Number one, we have the ischial spine. Let me get the pen so I can point when I need to. We have the ischial spine. You can see that here. You can see it labeled here already. The ischial spine is labeled here. So, and what is the function of that ischial spine? It is an important landmark. That ischial spine is an important landmark, and it also serves as point of attachment for sacrospinous ligaments. Please take note. That is ischial spine. Another thing I'll talk about is the ischial tuberosity. You can see it being labeled here. That is when you sit down, most of the time you are sitting down on this ischial tuberosity, but you won't feel the pain because of you have a lot of fats that are covering this side, so that you don't sit directly on your ischial tuberosity. So the ischial tuberosity is also an important landmark so far the ischium is concerned, and it's for the attachment of what we call the sacrotuberous ligaments. The image I showed you the other time, you must have seen the sacrotuberous ligaments. The image I showed you the other time. Let me get the image. This is the image. So you can see the sacrotuberous ligaments in certain way on the ischial tuberosity. You can see it here. Okay, so apart from the sacrotuberous ligaments, we also have the hamstring muscles. What are the hamstring muscles? These are the muscles that are at the posterior thigh. The hamstring muscles there. You can take note of that. You can put that down. Hamstring muscles are the ones found at the posterior thigh. So, and it's also connected to this ischial tuberosity. So next one I'll talk about under the ischium is the ischial ramus. We have ischial ramus. So you can see the ischial ramus here. I'm going to explain that with this. You can see the ischial ramus here. So let's talk about ramus. Ramus is just another word for projection. So talk about ramus, you're talking about projection. Sorry. So you can see that here. This is ramus, this is ischial ramus. So the ischial ramus is here. This is the pubic ramus. This is projection from the pubis. They are both joining and meeting at this point, which is called the ischiopubic ramus. The ischiopubic ramus also allows attachment of some muscles, some hip adductors, adductor adductors. They are attached to this ischiopubic ramus. And what is forming the ischiopubic ramus? The ischial ramus and the pubic ramus join together to form the ischiopubic ramus. So I've mentioned some major structure on this ischium, and I believe you've understood that already. So we'll talk about the ischial spine, which is a very important landmark, and it helps to separate the greater sciatic notch. You can see this place. This is sciatic notch, and the lesser sciatic notch. You can see. So what is separating the greater sciatic notch from the lesser sciatic notch? It is what the ischial spine, and that ischial spine itself is also it is also the point of attachment of some ligaments. such as the sacrospinous ligament. Sacrospinous ligament. These are ligaments around the back that does not have that are giving the hip bone rigidity posteriorly, that supporting the hip bone posteriorly. Sacrospinous ligament, sacrotuberous ligament, they are all meeting together here. You can see them here. They are giving it rigidity so that it does not pull up. In fact, they are connecting the ilium, the ischium. For in the case of this sacrotuberous, you can see it's connecting this ischium to the other part of the other part of the pelvis. Yeah, that is the coccyx and the sacrum. So similarly, the sacrospinous ligament too is doing the same thing. It's just fixing it together to the exoskeleton. So that is that. So lastly, they talk about the smallest bone, which is the pubis bone. The pubis bone also has some structures I have mentioned already. So we can see the superior pubic ramus. That is the one moving upward here. So we also have the inferior pubic ramus. I've mentioned that before, and I said it's connecting with the pubic ramus of the ischial ramus to form what the pubic ramus. And lastly, we have the pubic tubercle. We're going to show you that this is what we have, the pubic tubercle. In fact, the inguinal ligament I mentioned earlier on, which is originating from where? From the axis, is inserting where? On this pubic tubercle. You can see it there. This is the red ligament I mentioned that time. So it's coming from here, inserting here. So and that point here, this point of insertion is called the pubic tubercle. So those are the basic things concerning this hip bone, the ilium, the ischium, and the pubis. So you can just sit down and ask yourself some questions so that you can remember these things, and you are good to go. Next video, we'll move to the next aspect of the lower limb.